Menopause is the milestone in every woman's life that marks the end of her reproductive years. The symptoms that signal this time can range from mild to severe. As we hear from Dr. Susan Sklar, Medical Director of the Women's Wellness Center in Los Alamitos.
Determining when and how to treat menopausal symptoms really depends on a collaboration between the patient and the doctor. The first thing I ask is, are your symptoms a problem for you? Because some women tell me they have hot flashes, they have night sweats, but it's not a problem. They get caught up on sleep the next day, or they can function well in their jobs or activities anyway. So treatment should start being considered when a woman feels that her symptoms are significant. And symptoms may be hot flashes, trouble sleeping, emotional changes. Once these things start impacting her relationships and her daily activities, they should be treated. Menopause and osteoporosis have a definite link. During a woman's reproductive life, she produces estrogen, and this helps to maintain her bones in a strong and healthy state. At the start of menopause, with a lack of estrogen, bone starts thinning and dwindling. And in the first 5 years of menopause, a woman can lose as much as 15% of her bone density. And the concern with that is it puts her at increased risk of serious fractures later in life. I feel that waiting until age 65 loses an important time in a woman's life when she can be having preventive care. Once bone is lost, it's very difficult to replace it. So the main thing we want to try to do is to prevent the bone loss in the first place. So speaking to women at menopause about lifestyle, vitamins, calcium, exercise is very important, and screening women to see who has already lost bone or may be at increased risk at the start of menopause is important. The Sklar Center has a program for menopausal wellness, and the women that I expect to treat have a few reasons for coming. One, they may have difficult to treat menopausal problems that haven't been addressed adequately by prior physicians or providers. The other type of women that we see is a woman who's very proactive about taking care of herself and wants to know, what can I do now that I'm at this juncture in life to preserve my health long term? So we try to look at the entire woman. We have a psychologist who addresses her relationship, stress, and psychological issues. We have myself who looks at the medical problems of menopause. I estimate cancer risk, osteoporosis risk, and cardiovascular risk. We have an exercise physiologist who makes recommendations as far as exercise, a nutritionist who looks at nutrition, sleep, and other lifestyle issues, and our traditional Chinese medicine practitioner. If you have any questions about menopause, we have a list of resources on our website at sklarcenter.com.